Well, good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Wednesday, April the 7th, 2021. Joining us today is Toronto Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, and Toronto Fire Chief and General Manager of the Office of Emergency Management, Matthew Pegg. Mayor Tory?
Well, Brad, thank you and good afternoon. Our Team Toronto approach to the COVID-19 vaccine rollout has led to more than 636,718 doses being administered so far. We are the first region in Ontario to administer more than 600,000 doses, and I'm confident we're on track to be the first, as soon as the current supply allows, to provide for 1 million doses. Toronto alone has vaccinated more people than have been vaccinated in York Region, Peel Region, and Ottawa combined. More than 150,000 people have already registered to get their vaccine at a city-run clinic. On top of that, many more have signed up with hospital and healthcare partners. Almost 75,000 people have registered to get vaccinated since the province agreed to our request to lower the age of eligibility to 60. Throughout the Easter long weekend, our clinics were over 90% booked each and every day. I continue to urge all residents who are eligible to get vaccinated, please. The stories we've heard from doctors in recent days of people suffering and dying from COVID-19 are heartbreaking, as has been the case with the more than 2,800 people that we have lost in the City of Toronto alone since this pandemic began. The virus is real, and the variants are raging right now. The vaccines, any of them, will help protect you and your loved ones. So please get informed, please get registered, and please get vaccinated. Go to toronto.ca/COVID-19 or call 1-888-999-6488 to book your appointment today. I want to thank Premier Ford and the provincial government for moving ahead today with further public health measures to help put down the third wave that is currently raging. These decisions are difficult and require courage. As you know, I said last week that as mayor, I would support a stay-at-home order and tighter capacity restrictions if public health officials recommended them. I welcome the fact that the measures announced today do try to address some of the unfairness that has existed as between small business owners and big box stores being able to sell non-essential items over the past number of months. Also, I support the suspension of residential evictions that the Premier announced today, as I have done over prior months. This is also the right thing to do. And it is clear that the province shares our focus on getting vaccines to hotspots where they're needed. This shutdown is province-wide, and we know consistency is needed in order to ensure that we can stop the virus everywhere. Now all we have to do is to do our part and to stay home as much as possible and continue to wear our masks and not socialize with people we don't live with and the rules that people are very familiar with. During this shutdown, we are racing to get people vaccinated as much as we can with the supply that's provided and available to us. I have asked our public health officials and city staff to work with our hospital and healthcare partners to develop a Phase 2 plan, which will ensure that our Team Toronto approach to vaccinations continues and increases in effectiveness. The objectives are simple. 1, continue our coordinated Team Toronto effort involving everyone who is providing vaccines to people in the City of Toronto. 2, use every dose as fast as possible. 3, make sure we are doing all that we can to vaccinate our vulnerable residents, especially essential workers, where many of them live, namely in hotspot neighborhoods. We understandably talk a lot here about our city-run clinics, but every day there are and there have been dozens of other vaccine clinics in operation across Toronto run by our hospital and healthcare partners. Our public health officials have been clear that we must all focus our efforts on hotspot neighborhoods in our city, and the easiest way for people to understand that and to access a vaccination is by postal code. So we are working with the hospitals and other healthcare teams and with our own city teams to operate more mobile and pop-up vaccine sites in hotspot neighborhoods as soon as possible. We have to get shots in arms in areas where they're needed the most. We're announcing today that Toronto Public Health has worked with our hospital partners to ramp up our vaccination efforts in these hotspot areas. There's an absolute need to vaccinate essential workers, and this plan will ensure that we bring vaccines to the 111 neighborhoods that we know are COVID-19 hotspots and where essential workers and their families live. Ontario health teams and hospital mobile clinics and pop-ups will be vaccinating people 18 and older in these neighborhoods identified by their postal codes. The combination of age and postal code will determine eligibility for a vaccine. Some hospitals already have this work underway, and I encourage people who are eligible based on age and postal code to get vaccinated right now. It's never too soon. We've been working with the province to lower the age of eligibility further down in these hotspot areas, and so today's announcement is welcome. Public Health is also working with hospitals to establish essential workplace on-site clinics. We would start with piloting at 2 locations that would be focused on vaccinating not only the on-site workers in those workplaces, but also people who live or work in the area surrounding the workplace. Our work and outreach into communities is based on the backbone represented by the city's vaccine sites. We have an excellent system in place right now where anyone who is eligible can register and get an appointment at the city-run vaccination sites. We have 3 more clinics opening next week, which we expect will be popular local options for local residents, just as the recently opened sites have been. Starting Friday, residents 50 and older in high-risk areas, as identified again by postal code, will be able to book vaccine appointments at the city-run clinics. And of course, all of those 60 and above who've been able to register at those clinics for some time will be able to continue to do so. If people can go to these clinics, they should, if they possibly can, and they will get excellent care from our staff as they get their COVID-19 vaccination. But, as we always knew we would have to, we are expanding the system so that we can take vaccines directly to people who need them and, as often as not, may not come to us. These mobile and pop-up teams and hospital clinics also provide first-class care. And they are committed to getting the vaccine where it is needed the most, in the arms of our most vulnerable residents in those hotspot neighborhoods. Our public health officials have been very clear that we must get the vaccine to the neighborhoods that need it the most, and that this data-driven approach will ensure that we get essential workers and their families vaccinated. We're going to take vaccines to the neighborhoods where essential workers live and where they work, and it is my hope that we'll see the success of this strategy and its expansion in the coming weeks, thanks to vaccine supply, which is a necessary prerequisite of this, and thanks to the ongoing support of our healthcare and hospital partners and the province. And I want to at this juncture, because when you ask for these plans and they get put together as quickly as has been the case, it takes a lot of work by a lot of people under the leadership of both Dr. de Villa and Chief Pegg, and I want to thank them and their teams for putting together this expansion of our plans into these hotspot neighborhoods so that we can take the vaccines where they're needed the most. I know that the latest shutdown, if you want to call it that, is not what anyone wanted to go through again. We're working harder every single day, as I've tried to evidence today, to get these vaccines into the arms of those who need them the most. This effort will continue throughout the shutdown, and I'm confident it will allow us to emerge and avoid further shutdowns and lockdowns over the course of the summer. That's what this is all about. We stay home now, we go and get vaccinated now, we save lives, we save our summer, and much, much more than our summer. We save socially, we save economically. We have benefits right across the board if we can do that now. Stay home and get vaccinated. We get more people, essentially, and especially our essential workers, vaccinated now. We save lives, we save jobs, we save the summer, we save economic damage, further economic damage. I'm confident that the steps announced today in the vaccination area, together with the provincial actions undertaken today, will move us in the right direction of those goals, starting right away. And I thank you in advance for your anticipated cooperation, both in following the public health measures and in arranging to get yourself and to get your family and your friends vaccinated as soon as you are eligible. I'd now like to ask Dr. de Villa to offer her remarks for today.
Thank you, Mayor Tory, and good afternoon. Today, I am reporting 1,173 new cases of COVID-19. 33 new admissions bring the number of people in hospital to 426. 65 people are in the ICU. And sadly, I'm reporting 4 more deaths to COVID-19. The current number of cases screened positive for variants of concern is 10,382. From last Thursday and through today, we have seen almost 7,000 new cases of COVID-19. Today, the Premier announced further public health measures in Ontario. I support any and all solutions that achieve the objective of measurably weakening the disruption that COVID-19 is forcing in all our communities. Our job now is to respect and follow those measures. We do not have enough time, nor do we have enough vaccine to vaccinate our way out of this third wave. While we move forward with vaccinations, the success of public health measures lies in the extent to which we adhere to them and keep our distance. That I am reporting nearly 7,000 cases in 7 days says more about the threat we face than anything I might describe. Toronto Public Health continues to work with our healthcare partners, as you've just heard, across the city on ways to deliver vaccines to create the largest possible benefit for the greatest number of people. Our plan, which we developed jointly, will see the continued operation of the immunization clinics that provide vaccines under the parameters of the provincial framework. At the same time, we are creating opportunities to widen vaccine access for high-risk neighborhoods by taking vaccines to them through expanded pop-up and mobile clinics. These neighborhoods were identified by the province using data, including infection and hospitalization rates for COVID-19 and other factors, including racialization, income, and quality of housing. And Toronto neighborhoods have had vastly different experiences with COVID-19. Last week, one Toronto neighborhood within a hotspot had a weekly incidence rate of 682 cases per 100,000 population. In contrast, the citywide incidence rate for the same time period was 196 per 100,000 population. The extent of the resurgence and persistence of these high case counts compel us to determine what ways will best outsmart the spread of the virus and the variants. Like many of you, I am waiting for my turn to be vaccinated. By including specific focus in our vaccination plan, we begin to create a new front line of immunized people who are most at risk of acquiring and spreading COVID-19, but whom, through their vaccination, now give COVID nowhere to go. This, in turn, creates a protective benefit for everyone. If need be, our approach can be adapted again to reflect the circumstances of highest risk and need, and to produce the greatest benefit to the largest number of people. Today is the first day that we are back to exclusively online learning for children in the Toronto school systems. We concluded yesterday, Toronto has reached the point where there were no alternatives that would provide for continued in-class learning, a decision made with great care and careful deliberation. I have said, and Toronto Public Health believes, that schools should operate as safely as possible in the pandemic, but never at all costs. To this end, our schools have been safe, and the actions we took were aimed at keeping them that way. We have also said that in a pandemic, schools should be the first places to open and the last to close. Not all homes are homes where the parents can both work from home and supervise online learning. Many are homes where neither parent can work from home. Many are homes with only one parent who may work outside the home. For some, closing schools sounds like an easy decision, but it is one with many, many implications. Our conclusion yesterday was that the circumstances no longer allowed for classroom learning, and so we took the decision after extensive consultation with the school boards and others. The spread in the community was being reflected in schools to an extent where we determined community spread would drive risk at schools higher and higher. And that leads me to a point I cannot stress strongly enough. We now have asked for a massive sacrifice by our children and young people. Their best learning environment has been taken from them, the protections and stability and connection of school community withdrawn. The extent of the spread in the community imposes a greater burden of living with COVID-19 on children and young people, a burden that people their age should not be asked to bear. In exchange, we must act to create circumstances that will allow them back into school as soon as possible. That's a simple standard to measure. Fewer cases, less spread, more vaccines. We've got to get this done. There is not enough vaccine, nor enough time to vaccinate our way to the other side of this latest, overwhelming wave. So please, abide by the stay-at-home order. Practice self-protection measures. Get your vaccine as soon as you are eligible. In so doing, everyone in Toronto will be better protected, safer, and ultimately healthier. I'll now turn it over to Chief Pegg to deliver his remarks.
Thank you, Dr. de Villa. On Monday morning this week, we opened the 6th city-operated COVID-19 vaccine clinic inside the hangar in Downsview Park. When operating at full capacity, this vaccine clinic includes 40 immunizers and a full complement of staff supporting efficient and effective operations. As a reminder, the City of Toronto is currently operating 6 COVID-19 vaccine clinics. These clinics are located inside the Metro Toronto Convention Centre, the Toronto Congress Centre, the Scarborough Town Centre, Mitchell Field Arena, the Malvern Community Recreation Centre, and the hangar in Downsview Park. All 6 of these clinics are open 7 days per week, with appointments available between 11 a.m. and 8 p.m. daily. In designing and operating our city-operated clinics, we continue to prioritize a safe, efficient, and effective client experience. Wait times for those who arrive shortly before their scheduled appointment in a city-operated clinic are very short, with most people not having to wait long at all. In fact, the majority of people are checked in, vaccinated, and checked out of the clinic in about 30 minutes. Our immunization task force continues to be focused on vaccinating as many people as possible, as quickly as possible. This is a goal supported by our Team Toronto partners, including the City of Toronto, Ontario Health Teams, hospitals, pharmacies, and primary care physicians, all of whom are working in collaboration to maximize vaccine rollout across Toronto, including supporting mobile clinics as part of Phase 2, as announced today. In that spirit, I'm pleased to confirm that we will open the final 3 city-operated vaccine clinics at 11 a.m. on Monday, April 12th. These clinics are located inside the Cloverdale Mall, inside the North Toronto Memorial Community Centre, and inside the Carmine Stefano Community Centre. Community interest in these new clinics is very high, with all three being nearly fully booked for the first few days of operation. As of Monday, this brings the total number of city-operated vaccine clinics to 9. Anyone who was born in 1961 or earlier can book their appointment to receive their COVID-19 vaccine by accessing the online booking system, which is available at toronto.ca/COVID-19. Or, if you were born in 1961 or earlier and would prefer to book by phone, please call 1-888-999-6488. Please do not contact 311 nor Toronto Public Health for assistance in booking your COVID-19 vaccination appointment, as our staff are not able to access the COVAX system on your behalf. Please continue to monitor toronto.ca/COVID-19 for the most up-to-date information on immunizations in Toronto. Thank you.
Thank you, Chief. Before we go to questions, just a reminder to reporters to please unmute yourself before asking your question, and we'll go first to Brian Passafume from the Toronto Sun. Go ahead, Brian.
Hi, good afternoon, everybody. First question is, last month the city announced a $5 million RFP to create a mobile vaccination program. In terms of what was announced today by Premier Ford, what is the progress of the city's efforts in that regard, and how do those efforts fit in with the province's plans?
So, Brian, there we go, Brian. I believe that there was a $5 million grant, but it was more around getting community ambassadors and agencies to help us in terms of speaking to communities around the city rather than through mobile programs. What we have planned for as part of our immunization plan is to have some mobile and pop-up clinic offerings courtesy of Toronto Public Health and the City of Toronto immunization efforts. And of course, as I mentioned, we're working with our hospital and healthcare partners who have been offering a number of mobile and pop-up clinics throughout the city for a number of weeks now.
Okay, my second question, in terms of the timing of yesterday's announcement that schools would be closed, it left parents with very little time to make arrangements this morning. The mayor issued a statement last night suggesting he wasn't a fan of the short notice. Can we get a bit of an explanation as to why parents were given such short notice and such a huge shakeup to our daily routines to accommodate this?
Yeah, so Brian, I have to tell you, I'm not a big fan of short notice either. And, I will tell you that the decision was taken very deliberately and with a great deal of consideration. I think that at the end of the day, taking these kinds of decisions is never simple. We know that there are many, many implications associated with that. That being said, my responsibility is fundamentally to health and safety and to ensure that the actions taken really protect the health and safety of our children and all those who work within the school environments. So as difficult as I know as that was, as a parent myself, I understand that these are very, very challenging circumstances, but I do hope that the people of Toronto understand that the intention was really around best protecting the health and safety of our children and all those who work within the school environment.
Mr. Mayor?
I just wanted to make clear that while I canvassed the issue of notice very thoroughly with Dr. de Villa, because I was very concerned about the impact that the decision would have on parents, when she assured me in those discussions that she felt that the urgency of the decision in order to keep the schools safe, that we're safe and to address the health issues was of a sufficient urgency that we should move forward with it, I supported that decision, and I still do. But I did think it was appropriate, and we did have a very thorough discussion about the timing and some of the difficulties that posed for parents and families across the city. But in the end, the health concerns were deemed to be very urgent and appropriate to act upon yesterday afternoon.
Thank you. We'll go next to Anushka Yadav from Global News. Anushka?
Good afternoon, everyone. So my first question is, today Education Minister Stephen Lecce says that he feels closing schools was wrong. but Global News has learned today that at least 2 private schools were conducting in-class learning. Why are private schools in Toronto continuing to operate even after Toronto Public Health mandate to close? If you could comment on that.
So thank you for the question. That's certainly the first I've heard of that. If you provide us with information, we can certainly follow up. The order clearly does apply to all schools within Toronto, and it's our sincere hope that our school partners, whether they're publicly funded schools or private independent schools, are interested in working together with us to preserve the health and safety of all of our school communities, regardless of how they're funded.
Thank you so much. My next question is to Dr. de Villa. After the Education Minister's announcement today, will you continue to invoke Section 22 to keep schools in Toronto closed after the April break?
So at this point in time, the order has been issued to cover up until the period of the end of the April break. It's actually my sincere hope that we actually get our children back to in-person learning as soon as possible. Of course, health and safety remains my paramount concern, as it always is when it comes to children or any other members of our community. And it's my sincere hope that we as a community actually do our part to protect our schools. And the way we do that is by staying home as much as possible. We've seen a series of public health measures taken by our provincial counterparts. These are difficult measures, but they're the necessary measures at this point in time. The more we can reduce community spread of COVID-19, the sooner we will be able to assure the continued safe environment in our schools that they have enjoyed so far. That's the ultimate goal here.
Thank you. We'll go next to Nick Boisvert from CBC News. Nick?
Hi, thanks. I'm just looking for some more reaction to the measures announced by the province today, and specifically when it comes to essential workplaces, warehousing, manufacturing, the places that have been really identified as hotspots. Do you see that enough is being done as part of these measures to actually combat some of those outbreaks?
So, Nick, I'll be quite upfront. I haven't had a great deal of time to really look into what measures have been announced in great detail. I'm certainly pleased to see that measures have been taken on several different fronts to control community spread and to do the best we can to mitigate the impact of this current wave that we're facing. So I think to that end, it's beholden on all of us as members of communities all around this province, but I speak specifically to the residents of Toronto, to continue to really do the best you can, to practice those measures for self-protection, to abide by the measures that have been put forth thus far, to get your vaccine as soon as you're eligible, because this is what will protect us all, and it's what will get us to the other side of this pandemic in the most expeditious way possible.
And for people who are 18 and above in some of those hotspots that have been identified, can you give them a timeline as to when they could expect to actually go and get a shot?
Well, I think with this being a very new announcement, we have yet to work out a number of details. We're interested in continuing to work with our provincial partners, to work with our healthcare partners, to figure out what is the best way, the most timely and efficient way to actually put this plan into implementation. Look forward to working with our provincial and healthcare partners more locally to actually get that done.
Thank you. We'll go next to Ben Cohn from the Toronto Star. Ben?
Hi, everyone. My question is for Dr. de Villa. How will you know when it's safe to reopen schools? Like, how low will cases have to be? How many people will need to be vaccinated? Are there targets like that?
Well, you know, the team back at Toronto Public Health is actively looking at key measures. We're certainly looking at the rates within the community, and there's been some guidance that's been put out there. Our approach has always been data-driven and evidence-informed, and there are a number of different measures that look at things like what is community rate, what do community COVID-19 rates look like? What are the percent positivities when it comes to testing? These are the kinds of things that we're going to be looking at in order to make our decision. But I would say this, it is my fervent desire to see our children back in-person learning at the earliest possible moment that we're able to ensure a safe environment for them. We have really been very proud of the work that we have done in concert with our school boards and our school communities and the school staff themselves to create safe environments throughout the course of the pandemic. And we have every intention of continuing that work with those partners. And we're really looking forward to getting our kids back to in-person learning as soon as possible, just given the significant health benefits associated with in-person schooling.
Thanks very much.
Follow-up, Ben? No?
No, I'm all right. Thank you.
Okay, thank you. We'll go next to Denise Peglinawan from the Canadian Press. Go ahead, Denise.
Hi, this question, I don't know, anyone can answer this. Mayor Tory last week announced that the city is working on mobile units to vaccinate essential workers. You've mentioned this in your remarks as well today. So I'm wondering when you think this initiative would start.
So why don't I start? We don't have a specific date quite yet. This is something that we're working through with our healthcare partners. As you can well imagine, there are some logistics involved here, making sure that all the pieces are in place. You have to think about, immunizers, vaccine supply, make sure you've got appropriate transportation for that. And of course, you want the opportunity to ensure that the workers understand when is the clinic coming so that they can plan for themselves, some information to go out in advance so they understand the nature of the vaccine and the benefits that the vaccine will confer. And of course, there are all the processes that need to be put in place in respect of consent. It is, a therapeutic intervention, a life-saving one, and one that we're really looking forward to working with our healthcare partners to put out in the community through a wide variety of initiatives that you've just heard about today, including those endeavors that we're piloting within workplaces.
And my follow-up, kind of similar to Brian's question, how does the province's announcement of vaccinating 18 plus in hotspots affect this vaccination of essential workers?
Well, I think that, I'm not sure that there is a direct correlation. Certainly as we go into hotspot neighborhoods, we know that a number of those hotspot neighborhoods are home to many essential workers all around the city. So certainly that augments any efforts that we have to protect workers, particularly those who work in various factories and places around the city where you cannot work from home.
Okay, thank you. We'll go next to Christina Tenalia from CP24. Go ahead, Christina.
Hi, everyone. Thank you so much for taking my question. Dr. de Villa, Mayor Tory, Premier Ford, of course, perhaps as expected, did not announce any provincial paid sick days or paid sick day program today. And a few days ago, Mayor Tory, you called on the province to step up their approach in this capacity. Today, the Premier reiterated the federal program, but as a colleague at the Toronto Star noted, the federal program is not the same as a paid sick day. A paid sick day would be immediate. There is no it's seamless. There's no loss of income. My question is, what will the impact be on our city, considering, special education workers can get vaccinated in Toronto next week, eventually adults here in the city in hotspots. But the paid sick day issue is something you have both spoken to and been quite strong in your words. What is the impact going to be now that we know, once again, this is not happening?
Well, I think that the point I've been trying to make repeatedly is that if the current federal benefit, which has been enhanced by the Prime Minister, and I acknowledge that, and I acknowledge that the two governments have been talking with each other about whether that is the benefit to go with, and they've obviously decided that is the one. And I certainly am not one who would advocate for two different kinds of benefits if you can do it with one that is reasonably simple to apply for and that is sufficient to allow people not to have the fear of losing their paycheck and therefore to go to work sick. And in the end, I think we really have to come to grips, together with organized labor, together with other kinds of organizations that would help us in understanding whether or not the current federal benefit that has been enhanced by the federal government is adequate to stop people from going to work sick, to encourage them to get vaccinated, and to make sure, for that matter, that they get tested. That's where this started, with people not being as willing to get themselves tested because they were afraid of testing positive and losing their paycheck. So it strikes me we still have some more work to do. I think we should take the ideology and the politics out of this, as between governments and as between various other interest groups, and sit down in a room, whoever has to sit there, and certainly the two governments have to be there, and decide for once and for all, is the federal benefit adequate or not? If it isn't, then it should be decided how it should be enhanced to make sure people feel comfortable getting vaccinated, getting tested, and staying home from work when they're sick. And the decision as to who pays for it, I don't think the public, I don't think the essential workers out there, they don't care about that. They just want to make sure that they have the protection they need if they get sick, or if they get tested, or if they get vaccinated, so that they can stay home without fear they can't feed their family. And I just think that there's been a lot of ping pong going on here, and we need to bring the ping pong game to an end, decide for once and for all if what's there is adequate. If it isn't, then fix it, and even worry about who pays for it later.
Dr. de Villa, could you comment on this?
Certainly, and I can comment on it.
Sorry about that. I didn't see you coming to the microphone. I mean, are you concerned that cases will, you said a few days ago things are horrific. Will things get more out of control, considering there are no paid sick days for workers in this city and in this province provincially?
Well, any measure that actually supports people to do the right thing in these circumstances would certainly be helpful. And we've seen a number of measures taken today to try to help people maintain distance as much as possible. At the end of the day, we know that people also have to participate actively in those measures, seeking to stay at home wherever possible. I, of course, would like to see paid sick days, even on a temporary basis, to get us through this pandemic, because we know when people stay home when they're supposed to, when they're sick, that actually helps to reduce transmission of COVID-19. That being said, we've got a number of measures that have been put forth today that are aimed towards creating environments that support the right behaviors. I think this is a good thing. And as the Mayor said, there's an opportunity yet for the different levels of government to come together around a table and have what I hope would be very constructive discussions around this important issue of paid sick days, even if done on a temporary basis.
Thank you. We'll go next to Dave Ryder from the Toronto Star. Dave?
Hi, all. Thanks for taking this. I just want to drill down on some of the previous questions and try to understand the logistics of, you've got a certain number of city clinics operating with a certain amount of supply, and you've got more clinics operating, yet you're going to do this whole other endeavor where everybody over the age of 18 in a whole bunch of neighborhoods is going to get vaccinated. So I just want to understand that. And does that mean people who might normally get vaccinated in the second stage in the city clinics are going to have to wait a little bit because the focus and the vaccine is shifting somewhere else?
So thanks, Dave, for the question. I would say this, we are just coming into this information ourselves, and so there is still quite a bit of conversation that needs to happen with provincial counterparts and, of course, with our healthcare partners who have been absolutely crucial to our vaccination efforts here in the city. So we are prepared to establish mobile clinics ourselves as the City of Toronto and Toronto Public Health. And we're certainly prepared to help augment the activities and clinics that our healthcare partners have been undertaking thus far. So lots yet to be worked out in terms of the specific details. And as you can well imagine, lots of moving parts on trying to manage a series of mobile clinics along with a series of fixed clinics. So we expect to have productive discussions with our healthcare partners, but unfortunately, the details are just not available until we have that opportunity to sit down and have those planning conversations.
Thank you. I guess for my follow-up, I'll build on that, and just so I understand, at this moment, you can't say how quickly those people in those neighborhoods can expect to get vaccinated, if it'll be within days or weeks or months. And it sounds like, if I'm understanding what you're saying, the city's vaccine supply right now that's going to those city-run clinics is not going to cover this whole other big endeavor that I think you're saying that would have to come from the province, or you just don't know?
Well, so I think it's a little bit of both, as it turns out. And I would point out, Dave, that there are actually mobile and pop-up clinics that are ongoing and have been ongoing for several weeks. The idea is to continue to have those clinics, those mobile immunizing teams proceed with their work and to expand to other areas in concert with us as city partners and all the other healthcare partners that are part of that Team Toronto vaccination program. Our hope is to get these things and to expand our efforts in the days and weeks to come. But let me be very clear, there are currently mobile and pop-up clinics that are happening in locations all around the city, over and above fixed site clinics that are located in hospitals, and certainly the ones that we operate as the City of Toronto and Toronto Public Health.
Okay, thank you. That concludes today's briefing. Our next scheduled briefing will be this Monday, April the 12th. Please stay well.